Thank you very much, Aparna, for your kind words, which I wish my father and my mother would have been here, because my father would have enjoyed it and my mother would have believed to all what you said. Be it as it may, as you can see, I went up to the podium without my jacket, because in India I feel at home. And at home I don't go with a jacket. My really regret is that I cannot speak Hindi, but I promise that I will speak in English, but in Indian accent. So, thank you. So what I would like to do today is to update you about the factors which are involved in autoimmune disease. And as you will see, it has a lot of implications for therapy, as you have heard in the previous wonderful talk. In 1988, when I was young and beautiful, I published a book which was called The Mosaic of Autoimmunity. And in this book, we have summarized all the factors that were known in those days. None of the factors that I will mention today were actually listed in the previous book. So it's really an updated list that you will see. So as you all know from previous talks that I've delivered here in India and elsewhere, the factors which are involved in autoimmunity can be classified into 4 groups. First is genetic. Never, ever an autoimmune disease will have no genetic background. And therefore, the previous speaker spoke about thyroid disease. Always when I ask somebody who comes to my room if anybody in the family has a thyroid autoimmune disease, and never I received a negative question. Always it's my father, my grandfather, my mother, and the reason is that thyroid diseases are the most prevalent disease in the population, about 2%, and it's a marker for me, but we will talk about new markers later on. Always we need some kind of deficiency or defect in our immune system to allow the immune system to attack our own body constituent rather than foreign invaders like viruses or bacteria. Women have a higher incidence of autoimmune disease, and we will discuss it later on. And last but not least, infections or environmental factors, which are not only infection, but by and large infection. And I will finish my talk with a new therapy that we hope that will penetrate into our clinics very soon. So let's start with geoepidemiology, which have been changed during the last 100 years. And indeed, during these years, we have seen an explosion of autoimmune diseases. If you take just United States, you will see that autoimmune diseases affecting more than 20% of the population. It's more than cancer and more than diabetes and more than other very common diseases. So we should pay attention to this increase in autoimmune. Why do we have this increase in the modern life? And you will see in the moment. If you try to depict the geoepidemiology according to the map, you will see that most of the autoimmune diseases are more prevalent as further you go from the equator, at the northern countries and the lower in the southern countries. You can see that India is not the most or the one with the most prevalent autoimmune disease, and you will see why later on in my talk. So what's the explanation that each one of the diseases, here I depicted just diabetes mellitus type 1 and multiple sclerosis, but it pertains to all autoimmune disease. So why do we have this geoepidemiology of autoimmune disease? So there are many explanations. One of them is the lack of vitamin D or the exposure to the UV light. And even in India, you have a lack of vitamin D because India and my country, Israel, are very sunny country, but we are not exposed to the sun. Basically, we sit in front of our computers and play the PlayStation. And therefore, it is recommended to every patient with autoimmune disease to take thyroid as a supplement, 2,000 units. I take thyroid 2,000 units. I don't have an autoimmune disease. And even my dog Billy used to take 2,000 units until he died, and now another dog is replacing him. So vitamin D is instrumental. It has no side effects. It's very cheap. It doesn't need prescription of a physician, and it can prevent autoimmune disease. So this is one lesson that we have learned from the geoepidemiology. But as you will see at the end of my talk, it's the fact that we have detached ourselves from some parasite, and specifically the helminths. Actually, we lived with them in peace for generation and generation, and now that we are moving to a more hygiene environment, we pay in an increased number of autoimmune diseases, and we will see how we can bring back the helminths in a safe way at the end of my talk. And last but not least, the countries in the north and the south are more richer countries, and therefore you find more obese people, and you will see that obesity is closely associated with different autoimmune diseases. Let's move for a minute to the genetics. We know, as I mentioned before, that all autoimmune diseases are genetic, and it's the concert or the play of the environmental factors with the specific genetic which will determine your autoimmune disease, and by and large you encounter with infectious agents. So in the recent years it has been found that there are some human beings, let's say people, who have a very aggressive immune system. It means that it fights better foreign invaders. And therefore, these people may have advantage in evolution, and actually they proliferate more than people who do not have this ability to fight the foreign invader. And one of these is the HLA-DRB1 haplotype. HLA-DRB1 is instrumental in the way that the immune system, or how the cells that are approaching the foreign invaders actually expose it to the immune system to better react against it. And therefore, it's not surprising that if you analyze all kinds of autoimmune diseases, you will find that there is a close association between these different autoimmune diseases and the different HLA type. As you can see here, you have Sjögren's syndrome, psoriatic arthritis, myasthenia, primary biliary cirrhosis, and this table can go for at least 30 or 40 different autoimmune diseases that were analyzed with this case. Moreover, as you know, some people, when they have one autoimmune disease, they are more prone to develop a second autoimmune disease, sometimes even third autoimmune disease. So you can see that some of these HLA haplotypes are closely associated with two diseases like thyroid and rheumatoid, or SLE, Sjögren, and thyroid, and so forth. So we can screen patients for the presence of this haplotype, and we can predict who will develop which autoimmune disease, and eventually you will see that you can predict which or when he will develop autoimmune disease. So it's very analogous to the screening of anti-TPO, and I would say that our prediction also involves screening of different autoimmune diseases in normal subjects who may have this HLA type. So you can see, as a previous wonderful speaker mentioned, we are moving from treating to prediction and prevention, as you will see later on. So let's take, for instance, the combination of the presence of anti-CCP, citrullinated protein, which is highly specific for rheumatoid arthritis. But if you have a subject who has this anti-CCP and he has HLA-DRB1, it increases significantly his ability or his chances to develop an autoimmune disease. This is 74 times that he will develop eventually autoimmune diseases. Moreover, if you are exposed to adjuvants which actually aggravate or enhance the immune system, like, for instance, silicone implants in women, or some vaccines that may have adjuvant, you can see again that this is associated with specific alleles of the HLA-DRB1. So maybe we should move to a personalized medicine, who should not have a silicone breast implants, who should not get this vaccine or another vaccine because he or she has a greater chance to develop an autoimmune disease. So it's not surprising that in an unknown journal called Nature, it has been published that those who carry this HLA DRB1 haplotype, they have a better reaction against foreign invaders, and in this case, it's salmonella and typhoid fever, and therefore they have advantage in evolution. I will give you just a case of a lady, a mother, who had antiphospholipid syndrome and vitiligo, two autoimmune diseases. For one reason or another, the GP has sent her blood for test and found that her beautiful daughter, 22 years old, a gymnastic trainer, had a positive antinuclear 1/160, it's positive. She had lupus anticoagulant, which is the most significant antiphospholipid antibody predicting thromboembolic phenomena and recurrent pregnancy loss, IgA anticardiolipin, and the question that the mother wanted to ask me whether she should take contraceptive pills or not. I did the mistake. I said no. So therefore, she only kissed her friend. And when she kissed her friend, she got the kissing disease, namely infectious mononucleosis with EB virus, and then she developed a full-blown picture of lupus and antiphospholipid syndrome. So as you can see, it's the infection and the genetic, the prediction, and actually the same infectious agent, like the EB virus, as you can see here, with the very aggressive kiss, as you can see here. But unfortunately, this lady had HLA-DR15, and she developed actually a deleterious disease, multiple sclerosis. Incidentally, in this very light kiss, as you can see, but HLA-DR3, the lady developed eventually a benign, so to speak, thyroid autoimmune disease. So the same infecting agent, different genetic background, and you can see why in the same family you can have the mother with SLE, the son with type 1 diabetes mellitus, and the daughter with pemphigus vulgaris. This is another case of a family in which both of them had a very heavy genetic background, and one of them developed, and one of them developed, as you can see, ITP, idiopathic thrombocytopenic purpura. It was called idiopathic when we were idiots and we didn't know the pathology. Now it's called actually immune thrombocytopenic purpura following vaccine. They had a child, and as you can see, the father comes from a very heavy family with thyroid disease. And the question was whether to vaccinate or not to vaccinate the children. I will not answer the question right now, but I will just allude to the idea that I say to vaccinate, but we have to be very careful that one of their daughters may develop actually an autoimmune disease. So eventually we will move to personalized vaccine in the future, and we have to understand that not all billion of people are the same when you expose them to adjuvant and to the antigens which are incorporated into the vaccine. It's like you take all the animals and you give them one test to climb the tree, and the elephant may have disadvantages in this case. So it's always the HLA-DRB1 which is so responsible for the presentation of the peptides to the immune system and to the reaction. So in the future, like with other drugs that we have already experienced, you can see we will have to check for HLA. And my dream is that when the child will be born, we will have all his HLA done at the maternity unit, and we will know also additional aspects, maybe cytokine level and other predicting factors, to know who should be vaccinated, who should be given this drug, and who should be treated in a different way. I would like to move to mechanism mechanism of autoimmune diseases, what do we know more? At the beginning, we believed that all autoimmune diseases are induced by molecular mimicry because of the historical event of rheumatic fever exactly 3 weeks after the streptococcal infection and finding the M protein, which is common to the streptococcal envelope and to our synoviocytes, also to our glia cells, as well as to our heart endothelium. And therefore, there was chorea, the deformation of the valves, as well as the joint involvement. But during the years, we have learned that there are many mechanisms by which infecting agent, environmental factor can join actually the genetic and induce autoimmune disease. So it's not only the copy-paste of molecular mimicry, but as you can see, exposure of cryptic antigen during infection and so forth. So as you can see, there are many factors in addition to the molecular mimicry that you can see here, like the exposure to some epitope, and then epitope spreading to attack and well-known antigens in our a constituent of our body. And actually, we have learned that these adjuvants in our environment, and one of them is aluminum, and you will see in a minute another very common adjuvant, work on the cells in different mechanisms, like working on the toll-like receptors, increasing uric acid, which is one of the most inflammatory agents in our body. And you can see also affecting the inflammasome to secrete all of our infecting agent, all of our inflammatory cytokines. So the new modern therapies actually are directed to block different of these mechanisms in autoimmune diseases. Just to give you an example, carrier of hepatitis C virus, which today, luckily enough, we can eradicate this virus, but these carriers are at a high chances to develop 9 different classical autoimmune diseases. How can one virus actually induce so many autoimmune diseases? So recently, we have found that these carriers actually secrete BLyS, B lymphocyte stimulating factor, actually, which proliferate lymphocytes to produce autoantibodies. It's not surprising that the first biological therapy in SLE that got the approval of the FDA is the anti-BLyS. So maybe we should treat these carriers with HCV, if we cannot eradicate the virus, by anti-BLyS early to prevent autoimmune disease. And I'm bringing you again to the fact that we are at an era of prediction and prevention of different autoimmune diseases. What are the new factors that we were not aware many years back that are involved intimately in autoimmune disease? So smoking. Actually, in 1983, in another unknown journal, Lancet, there was a paper indicating that in good pasture syndrome, in which you have antibodies against the basement membrane collagen 1 antigen and the kidney, they had hemoptysis and hematuria only when they smoke. We neglected this paper for many years. Today we know that SLE is intimately associated with smoking. I know that many of you are not physicians and you don't come into contact, intimate contact with your patient, but how many of you would have recommended to their patient to stop smoking because it can ameliorate and maybe even prevent the development of autoimmune diseases? We know today that by smoking, we inhale the smoke and we smoke the cells in our lungs. And it is believed, and we know that it may change the enzyme PAD, the one which is responsible for citrullinarization, and therefore those who smoke are at a greater risk of developing, for instance, rheumatoid arthritis. Actually, smoking changed many proteins there, and there is a belief that this smoke, which contains also, as you can see, aluminum, which is an adjuvant, is responsible for all autoimmune diseases by changing the different antigens to autoantigens, and then some immune adhesion molecules determine if the cells will go to the brain to develop multiple sclerosis or to the kidney to develop SLE. This is another paper from Nature which refers to the hub and spoke T cell trafficking from the lungs actually to the different target area in our body. I would like to refer to one very important environmental factor, and this is the plastic ingredient or compound called bisphenol, which is everywhere. I tested either the plastic bottles that you are drinking outside. They are constituting from with bisphenol, and you can see that we give our children also to drink from that plastic bottles which contain it. If you look in the literature, you will find out that this one molecule can affect the immune system in all these kind of mechanisms to induce autoimmune diseases. It stimulates Th1 cells. It secretes prolactin. And I saw one of the abstracts outside about prolactinoma, and we know that hyperprolactinemia is closely associated with increased autoantibody production and autoimmune disease. It affects Th17, the very high inflammatory cell line. And you can see that each one of these mechanisms is involved with one compound, the plastic compound. So this may urge us to reduce our contact with all these plastic constituents. And I know that in New Zealand, no more, you cannot get any plastic bags from the supermarket, only paper bags, as you can see. So this is just to show how this bisphenol can affect actually the hypophysis to secrete more prolactin. Here you can see how it affects estrogen. So actually, this compound transfer men into women by increasing their level of estrogen. Now, estrogen are extremely important. As you know, females are more prone to develop autoimmune disease because they have more aggressive immune system. They are actually reminding us the HLA-DRB1 haplotype, which have, as I mentioned, advantage in evolution. Actually, women are the stronger sex or the gender, and not me and not us, the men. As my wife always tells me, what did you contribute to the world as Schmitchik? But I was the incubator, and therefore, God, who is a male and loves female, gave them a better immune system to overcome different immune attacks. And indeed, as you know, also in India, when all the males will die here, their wives will be able to marry at least twice in the future. So if you take, for instance, mice who are NZBW and you are expose them to estrogen, they will develop a more aggressive, earlier disease, as you can see here. And when it has been found what the estrogen are causing to the immune cells in the female, they are increasing the secretion of BLyS, B lymphocyte stimulating factor. And you can see immediately the common denominator between the bisphenol from the plastic and actually being exposed to the estrogen. If it is due to contraceptive, is it because of pregnancy? Is it because we induce in vitro fertilization and these women can expose their immune system? And actually, part of the postpartum explosion of thyroid disease is because there is disbalance between the estrogen and the progesterone exactly or immediately after the delivery of the child. So as you can see, there are common denominator to this, and you can see that in histological studies, those who are subjected to estrogen have a very aggressive kidney disease in this case, and the mice actually die earlier when they are exposed to the estrogen. Environment. I remember that a patient with systemic sclerosis, 50 years old, male, Usually we have 20 times more females than males with scleroderma, and when he left my room, and I thought that I found the reason because he worked with batteries. He asked me, is it because I'm living close to the airport? I asked him, why do you raise this possibility? He said, in our village, we have 150 families and 5 males who suffer from scleroderma. I said, wow, I don't know. I let my finger go on the computer, and sure enough, there is a paper from England showing that the closer you live to the airport, the higher incidence of scleroderma because of the ejection of all these fumes from the aeroplane, which contains carbohydrate that can involved in the induction of scleroderma. So it's not surprising that the last months in arthritis and rheumatism, there was a paper showing an increased autoimmune disease among the workers who worked in the Twin Tower that were destroyed in 1911, and among all the disease you can see myositis, even lupus, Sjögren, and systemic sclerosis. What about the diet that we try to neglect in autoimmune diseases? So this is actually a study that we have done many years back in which we were able to show that by enriching mice who are prone genetically to develop autoimmune diseases by high unsaturated fatty acid, we could prevent the development of the glomerulonephritis in mice with SLE. So today we pay attention to it, and we know that dietary factors actually can affect cytokine levels. And actually, if you change to Indian diet, to the vegetarian diet, which I like so much, I love Indian food. The more spices, the better, but the spiciness is another story here. It's better to reduce the levels of the inflammatory cytokine. In the last year, it has been found that the fat actually tissue is not inert. It's a very active. It's a very active tissue. As you can see, it secretes different cytokines by itself. Some of them are named leptin, resistin, and visfatin, and all these, and especially the leptin, can induce all these inflammatory cytokines, TNF-alpha, IL-1, IL-18, CCL2, and so forth. So the fatter you are, the higher the chance that you will produce leptin, the higher the chance that you will produce these inflammatory cytokines. And therefore, it's not surprising that in all autoimmune diseases, including rheumatoid arthritis, you can see a higher incidence of rheumatoid arthritis among fat people. And if you will take this table from our article in Autoimmunity Reviews about actually obesity and autoimmune disease, you will see that each one of these diseases, rheumatoid arthritis, multiple sclerosis, psoriatic arthritis, and so forth, and even thyroid autoimmune disease, are closely associated with obesity to indicate that actually we have to change the mosaic of autoimmunity and to add smoking as well as obesity to this increase in autoimmune diseases in our modern life. What about salt? The previous speaker mentioned the salt in a very positive connection, but I would like to show you that salt is not good for our elderly patients with congestive heart failure or other diseases, but it has been found recently in another unknown journal, the New England Journal of Medicine, in a paper called The Salty Taste of Autoimmunity, that salt may increase the signal transduction in the cells toward the inflammatory signal transduction, and specifically to the SGK1 kinase. And here you can see a collagen-induced arthritis to mice, some of them who received high-salt diet and some of them low-salt diet. And you can see that those who had in salt low-salt diet, they had no inflammatory reaction in their joints. What about therapy? Therapy has been changed. Still, we are using glucocorticosteroids, despite all the side effects. in the future, my students in 10 or 20 years will not understand how did we dare to give corticosteroid with all their side effects, because we will have a replacement to this corticosteroid. Unfortunately, still we need to use these therapies since 1954, when Nobel Prize was given to the 3 people who revealed the action of the corticosteroid. But there are novel therapies. First of all, antibiotics. Since we know that there are different bacteria which are involved in the initiation of the disease, maybe if we will be able to tackle the disease at a very early stage, just by antibiotics, we will be able to eradicate